Hello, hello, and good evening to all of you who are listening in on Protecting the Vision, our National Optometric Foundation webinar. And I am excited to be your host for this show today, Dr. Timothy Brown, Treasurer for the National Optometric Foundation. And we have a great webinar for you today. So I hope that you're listening in. You're going to text your family and friends, email them the link to our YouTube channel so that they can also tune in for the great information that our guest speaker is going to share with us tonight. And boy, we have a dynamic speaker on the webinar tonight. Never before have I had this type of speaker on the webinar there, and I'll introduce him later on there. The National Optometric Foundation, for those of you who may not know, is a nonprofit organization. We are the financial arm for the National Optometric Association. That's our parent company. We also have a student organization, the National Optometric Student Association as well. And we try to support both the National Optometric Association and the Student Association in various ways through financially giving of scholarships, grants, trying to support the community in various ways. There are churches through free eye exams every year when we do our NOA conferences and convention. We do free eye exams and we partner along with companies, great companies like VSP, who provide glasses and services for the people in the community. A lot of people leave happy with eyeglasses for the day that we're doing those vision and eye exams there. So we want to continue to do these great things here for the community, for the church, for schools and different organizations, and supporting those who are thinking about going into optometry as their career, becoming your future optometrist. We need to be that support link for them as well. And we want to also continue to educate our communities in different ways. That's why we do this webinar, to provide education to the communities. And we encourage you to share the link to this webinar for tonight so that you can continue to be educated and spread the information that is going to be shared with you on tonight there, because the National Optometric Association always lean heavily upon the three silent killers of your vision, trying to educate the community about those three silent killers of your vision: glaucoma, diabetic retinopathy, and also hypertensive retinopathy. And we want to make sure that we can continue to provide the scholarships for students. And we are so thankful for those of you who have generously given towards the cause and you sent in information. So if you want to follow us, we do have a website. Our website is nationaloptometricfoundation.com. We also have a Facebook page under the same name, National Optometric Foundation. And we also have a Cash App if you would like to contribute to the things that we're doing, allow us to be able to do that. Our Cash App is $ protecting the vision that we have there. And we also want you to know that on YouTube, we have all of our previous webinars, and this webinar for tonight will also be posted there. We're thanking our program manager, Mr. Jason Mahoney, and his team for doing such an excellent job in doing that. And we're on YouTube there as National Optometric Foundation as well. So guys, continue to follow us, listen in. I want you to go ahead and grab your favorite drink, maybe even some popcorn, and tune in tonight as we talk about dry eyes and options here. I have a great dynamic speaker. He's also a friend of mine, a great community leader there, Dr. Summerow, who is going to share some information through his experiences practicing as an optometrist. Not only is he an optometrist, but this dynamic speaker is also a pastor. And under his leadership and his tutoring and mentoring, he's helped this church and the community grow tremendously since his tenure there as the pastor. He is the pastor of the Greater Friendship Missionary Baptist Church in Macon, Georgia. He is passionate, committed, and he leads with grace as he served as the pastor of this great church for now over 10 years there. He previously was the pastor of Oldfield Baptist Church in Perry, Georgia, for 8.5 years there. Under his leadership, this has become one of the fastest growing churches in the Macon and Middle Georgia area there, where he serves as one of the most respected leaders in the local evangelical circles there. Dr. Summerow also started his educational journey by earning a dual undergraduate degree in biology, and psychology from Oglethorpe University in Atlanta, Georgia. Dr. Summerow furthered his education by obtaining his doctorate of optometry degree from Nova Southeastern University in Fort Lauderdale, Florida. And he obtained a diploma of biblical studies from the City of Hope Bible Institute in 2002. Now, I will tell you, among his certifications, Dr. Summerow is licensed to manage and treat ocular diseases of the eye, as well as prescribe pharmaceuticals in the treatment of eye conditions. But he's also certified to perform pre and post-operative care of PRK LASIK laser surgery to correct nearsightedness. This guy is a busy man. He's traveled extensively addressing religious organizations, medical societies, retreats, symposiums. He's a member of numerous professional organizations and received numerous awards for recognition for his community service in various areas and his work in the field of optometry. And he continued to serve his community. He's dedicated to living by example and encouraging men and women to live up to their full potential in Christ. And he's recognized for his balance in preaching the word and avoiding extremes, yet still not compromising or diluting demands of the truth. He's definitely a very gifted man. He's very gifted, and he has strong ties with local and civic organization, and has earned many highly esteemed community awards there. And he continues to bring the community out for local events that's going on, and also getting them together for things that may be occurring nationally as well there. He has two handsome and athletic sons through the marriage of his lovely wife and first lady there, Miss Joanna, bless her soul. And she's and they've also raised a bonus son, their nephew, as well as their own there. He accepts the challenge. He exceeds as a husband, father, optometrist, a teacher, a preacher, a counselor, spiritual community leader, humanitarian, role model, and mentor. Wow, that's a lot to sum up. You guys, I know that was a lot, and I didn't give it all to you. And if he cared to share more with you, he'll do that tonight. But I want to go ahead and bring him on the show. Dr. Stephen Summerow, come on to the show. We're so glad you're on the show today as our guest speaker. I am so honored to have you on one of my webinars here with the National Optometric Foundation, sir. Thank you so much for being on the show tonight.
Thank you for having me, Dr. Brown. It's amazing. I love the thing that, of course, the National Optometric Foundation is doing. I'm excited about all the things that you guys have in store for our community, and I love what you guys represent. So it is in line with my life as a total package. So I'm here for you. You guys know that already. So I'm glad to be on tonight. I'm excited about talking to this community of those that need to know more about eye care and eye health, as well as, my faith foundation. So I'm really excited about being on the show tonight. So yes, thank you.
Absolutely.
Thank
you. Well, I'm so glad, and we are going to go ahead and dive into the show and start talking about dry eyes and optic care. That's a big topic. A lot of people, they come in and they're complaining about things. They're saying, hey, doc, I got this going on, I got that going on. Yes. But I also recognize, as big as that topic is, it's necessary to try as much as we can as healthcare professionals to break it down for those who may not quite understand. They don't have the years of experience as yourself there and knowing about dry eyes there. So sometimes we got to slow it down and break it down for regular people. Okay. And a lot of you out there are listening. If you have questions, put it in the comment section, whether you're watching on YouTube or maybe you got with us on a Facebook page. Put your questions there. We'll do our best to try to get to your questions. I'll be watching that as well as he's speaking to us. But we want you to just, first of all, before you get too deep into the dry eye, a lot of people travel for your services. They
Yeah.
travel to you for your
Yeah.
services. So we want to know, who are you? Who is Dr. Stephen Summerow? What is it that you do? Tell us about your family, maybe your
Uh,
community involvement there,
yeah.
just so that we can get to know you a little bit more,
Oh,
please.
all right. Well, I'm Dr. Stephen Summerow, of course. I am one of the doctors at Eyesight Associates located in Warner Robins, Georgia and Fort Valley, Georgia. We're centered right in the heart of Georgia. My life is one that's been one of great fun and excitement because of what I do. I love, of course, preaching the gospel as well as helping people with dry disease. I've now made that my specialty, and it's become a huge part of my life. Now, as far as what I like to do outside of optometry and other things like that, I love hanging with my boys who are both in college. One is a junior, and he's in from Vermont and college, doing great things at Middlebury College. And my other son is working on his MBA right now, and he is actually at Samford University in Alabama. We love sports. We love all sports. I still play basketball, still work out regularly 3 to 4 times a week, still do a lot of stuff like that. So in order to do all the things I do, I have to take care of this wonderful body that the Lord has given me. And as far as preaching, teaching, I have to maintain a good, healthy aspect on the way I take care of myself. So that's one of the things I did want to. I know you guys got an old bio, so I got to correct something. And Tim, I don't want you to feel any type of way. I don't want you to feel, because it's my fault. You didn't know this, and I know you didn't know this. So everybody out there in the internet land, y'all don't get on Tim, but my wife passed away 5 years ago. She had a surgical procedure and it went south on us. And she did not make it out of that procedure. So everyone, I'm okay. Me and my boys are doing well now. But I know you said the husband of the wife. I've been a great husband. We were married for 22 years. And she passed away in 2018. So me and my boys, we're doing good now. I tell everybody we are doing great. We of course made it through that rough spot in our life, but now we are doing great. So I am a widower of 5 years, and a lot of people don't know. Some people do, and I know when you get that bio, it still has her on there, and that's just me that's my fault. So please, Tim, you're good, and I'm okay. I tell everybody that we are in a good place now. Me and my boys, of course, with our strong faith and the fact that we love the Lord. We know that some things are way out of our we can't control certain things. So we've recovered, and I always say it's a journey, not a destination. So that's part of me. But as far as me, the doctor, Stephen Summerow, I'm very busy. As far as me, the doctor, the pastor, I am in so many organizations right now, but I love it. I love what I do. It keeps me busy. I actually was supposed to be at a meeting tonight for the Union Baptist and Missionary Educational Association, for which I'm the treasurer, which is a 85 church organization. And I am the treasurer of that. So, but I told them this was important and I wanted to be with you guys tonight. As far as dry eye disease, now I am a dry eye specialist, and I have people traveling flying in to see me. I always tell stories about folks that come from many, many miles to get my care because word of mouth is so good. And so I thank God for that. That's just a blessing. So me, the doctor, I'm great. I'm good. I'm doing good things, doing great things in the community. I love treating dry eye. I think that it's one of the most overlooked parts of our profession. I think that as doctors, of course, looking for niches or something that you can find your own, I think is one that you can definitely look at. For all the folks out there in internet land, as far as dry eye disease, I guess we'll talk more about what it means to you, because when I define it and when I go into it, I'm just going to make it very plain to define that. So Dr. Brown, did you want me to do that now? Did you want me to wait to that? But the Dr. Stephen Summerow is a wonderful guy, okay? And he's in a good
Yes, you are. You are a wonderful, phenomenal guy and a great friend, and we enjoy you. We thank God for creating you. All that you bring, not just to the profession of optometry, but to the community around you, the local community, the global community. Man, you to be able to juggle, optometry and pastoring is a lot. It's a
Yes.
lot, you know. I was out skating with our pastor last night, you know. I know that
Excellent.
pastors are often needed and wanted with their local church, you know.
Well,
So,
where's my
and then
invite?
you got, you know, two sons, one a junior in Vermont, and then another one in Alabama, you know, and that's a lot, you know, for you. And I commend you
Yes.
for being able to balance all of that as well.
Yes, yes, yes.
Yeah.
I want to
So,
say also, I did throw this in there, and once again, I don't think you guys even know this. I've recently been selected for the Georgia Board of Optometry as a trustee, a regional trustee, and I just got invited by the American Optometric Association to be in their Leadership 2.0. So I will be one of the leaders
woo,
on the national level in the near future.
wow,
That's
that's
huge.
great,
Yeah.
great representation. They have no idea who they're about to bring on the team. They have no idea. It's going to just blow them away, you know, with
Yeah.
the skills and the insight that you're
Yeah.
going to be able to bring the organization is unmatched. So
I'm
I'm
excited.
willing to go on the books and say they've never had a leader like you before, and they're going to be surprised.
I'm excited about both of those appointments because I didn't ask for them. They came to me. So I'm
Wow.
excited about being a
That's
trustee regionally for the Georgia Optometric Association and also the American Optometric Association, which you know is of course, the big
yeah.
national association, as well as the NOA. Of course, I've actually held offices there as well, but I let you guys do it now.
Yes, yes, yes. You did
So
well, and I remember being under your
yes,
teaching when I attended one of the SECO experiences there as well. And you also we talked about you being a speaker at the NOA conference one
don't
year as
tell
well.
my age. Don't tell my
That's okay. You look young, and I mean, you have the personality, you
age.
know, that's just so attractive. You know, you're attracting a lot of people to you like a
Yeah.
magnet there. We appreciate that. And that's why I think it's fitting for you to be our speaker tonight, speaking
Thank
about
you.
dry eye.
Yeah.
And we want you to just kind of break it down there for those who may not be familiar with dry eye so that they can understand what it is there. And, you know, if you're doing it in your clinic there, you can
Where
talk
do
a
I
little bit
go?
about, you know, how you introduce it to patients there when you see that they may have a dry eye issue.
So the easiest way I can describe it for most patients and people is simply this: dry eye it can be multifactorial. It can be from tearing eyes to irritated eyes to red eyes. So many patients come into the office and they don't even realize they have dry eye. That's number one. So to put it in a small box would be, you shouldn't do that. Number one, you just simply should not do that, because a patient will come in and say, "Oh, my eyes have been irritated, my eyes have been upset. What's going on, Dr. Summerow?" And they want me to fix it immediately. And I always tell them, "Well, you're suffering from chronic dry eye." So it can be something as simple as your eyes tearing all the time. Many patients, they simply cannot understand why, if their eyes are tearing, how that can be dry eye. And I try to tell them this simple little story. I say, "Well, the way your body reacts is it's trying to fix the dry eye, and that's why you have the extra tears. The reason the tears are running down your face is because your eyes are so dry that your body's trying to fix that." Also, dry eye can be, and can present to a patient by blurred vision. Many of them will have blurred vision, and the analogy I give them for this is simply, imagine your car and you're driving it down the road, and the surface of the windshield is dry, and you hit the windshield wipers. Well, if it's dry, it's going to smear everything on that windshield wiper. Now, the way you make it clear is to add moisture. You press a little button on your windshield wiper, it shoots the moisture up on it, and when the wiper goes again, it clears it up. So the way I can tell them also is, if you're having blurred vision that seems to be transient, or it's fluctuating, it's here and then gone, and then here and then gone, you can also be suffering from dry eye. So I tell patients, don't think of one thing when it comes to dry eye, but think of many things. And typically, most patients will go on years with these symptoms. They will be tearing, and you can always see the classic grandmother or auntie or with that handkerchief, and she's constantly she's dabbing everywhere she goes. Oh my, oh my. And so that is a telltale sign for dry eye. So if you have a family member, if you have someone that's dealing with it and they don't know what to do, they're just not sure how to stop their eyes from running water. That's the term I hear. They don't say tearing, of course. They say my eyes run water all the time. So what you want to do is listen for that. And you also want to know that if those patients are dealing with those symptoms, grittiness, sandy eyes, then they have a dry eye problem. Another thing that I'm gonna leave you with this is that if patients have autoimmune disorders, most autoimmune disorders, sarcoidosis, lupus, rheumatoid arthritis, any of those autoimmune disorders, Sjogren's syndrome, they are accompanied by dry eye. 90% of patients with those disorders have dry eye. So just make sure if your family member are dealing with other systemic conditions that they make sure they get checked out, because I have so many patients that simply say, I didn't know I could feel better. They've gotten used to it. So, and that's why people drive for miles and miles around to come for me to take care of it. I have so many doctors referring to me now, rheumatologists, ophthalmologists, MDs, ODs, general practitioners. They have patients that are dealing with it. So,
Wow, that's incredible.
yeah. Yeah, it's really good now to see the way it's expanding, because so many individuals in different modes of practice are realizing that some of their patients are simply dealing with dry eye, and
Right.
we're trying to treat it with other things, and until you get the underlying dry eye fixed or treated, you're going to be running into trouble. So yeah,
Absolutely. Right. And I can imagine
yeah,
that people when they come in and they tell you my eyes are running water, the tearing that we talk about on the
mm,
professional side, and you tell them, I think you may have dry eye. And when you check everything, you tell them they got dry eye, and they're like, how can my eyes be dry when they're they're
they're,
they're running
they're
water all the
constantly.
time, you know?
Get that every day, at
Yeah,
least once a day, because they don't associate dryness with the tears. They associate their eyes have too much, so that's why they think that their eyes are not dry. So yeah,
so
absolutely.
those of you who are listening tonight, there you
Mhm.
go. If you've
Yeah,
been experiencing this, you should see your local optometrist, because
yeah,
you may need the treatment that he'll talk about later
yeah,
for the symptoms that you are presenting with there. If your eyes are running, you need to go see your optometrist there. And these are some things that your local optometrist can most of the time examine,
mhm,
diagnose that as well.
absolutely,
If you're going in for your annual eye exam, we
absolutely.
recommend that you have that annual eye exam there, even if you don't have what you consider to be problems. Go
Yeah,
in, it's part of your body, get that check done,
mhm,
and I always tell them, don't delay, get it done today,
yeah.
do it today.
Most
So
important to get it
we
done.
want to encourage you, through these webinars to
Yes.
preserve your vision. Come on board with us and make sure that you and your family members are getting your eyes checked on a regular basis. If I was a person dealing with dry eyes and I
Mhm.
could go see a doctor like Dr. Summerow who could take care of the problem, diagnosing it, telling me about it, going
Yeah,
through the treatment, I'll fly in to see you as well. I'll jump on a plane here in Augusta, hit right here in
yeah,
Atlanta, or I'll just drive and get it taken care of there. So I
yeah,
think it's great that you have that specialty. I think that
yeah.
that's the beauty of the field of optometry. You can specialize in various things dealing with eye care, and we're glad that you're in Georgia taking care
Yeah.
of the needs of those who have dry eye issues.
Mhm.
I often wonder, with your specialty that you have there, how does that look? How does your specialty look as far as your clinic? How is that set up? If there's certain equipment that you have, are you only doing dry eye? Will you still
No,
spin the
no.
doctor and do refraction as well?
Yeah.
Tell us a little bit about that clinic scene for you
My,
as well.
my day-to-day clinic, I'll see anywhere from 30 to 40 patients a day. I have two writers, two technicians that are working with me. I'm running 5 rooms while I'm going myself and another doctor. We're in a large multidisciplinary practice. We have 6 offices in total. My office, my main office, is one that we see in that office. Most of us, both doctors, we average between 35 and 40 patients a day. And so my day-to-day activities they're not all dry eye. I'm probably right now about at 45, 55%, 45% dry eye, 55% other things. So I treat and manage ocular disease. We do glaucoma. We do any ocular issues. I had a patient today, and it made me feel really good. She told me I saved her life, literally. And that was she said that the mother of this young lady came with her and said, you have all my family now. We're not going anywhere else, because the neurologist that I sent her to fix the problem that she had said that he saved her life. And so that is one of the things that, from a routine eye exam, she thought she was coming in for something else. She had swelling in the back of her eye, all the eye ducts out there, papilledema, but she actually had the reason her nerve was edematous or swollen was because she had an infection in her spine. And so when they tapped her spine and found out, we saved her life. So had we not done what we done, she had been other places before and everyone was blowing her off because of her headaches, but we got her to the right care immediately and urgently. And the doctor told her that Dr. Summerow really took care of you. And so her whole family's coming to me right now. So that's the importance, like you said, of routine care as well as comprehensive care. But I do everything within the scope of my license. I'm doing, for my normal day with dry, I do procedures. There's procedures that I do for dry. I do IPL, I do amniotic lenses. I do many things that other doctors may not do so much, but I go the full expanse of dry eye treatment and disease therapy. So I'm on the outskirts. I'm doing the things that other doctors, and many doctors refer to me. They may try a little bit, and when they can't get the patient treated with normal routine dry eye care, they will send them to me for the extensive stuff. So yeah, but my routine day, and I do contacts and glasses too. I do the regular stuff too. So if you need some good quality contacts, I do that as well. And those are routine things, and I take those. But you got to make sure that my practice, where I am, my normal day starts about 8:30, quarter to 9, and then I go to about 4:30, and I'm done, and I'm home by 5 and hanging out and doing church stuff. So my days are sometimes long because of church things that come after work. But my normal day in the clinic, I have technicians, we're moving, we're going, and with 40 patients to see, you don't get to sit around. So yeah.
Wow.
And I know a lot of doctors are going.
That's an incredible schedule there, Dr. Summerow. That's an incredible schedule. 30 to 40 patients a day. You are moving. You are not sitting. Absolutely, you're not sitting. And
but quality of care is important. Quality of care is important.
Quality of care.
I will sit down and explain something to a patient. And that's why I think that, patients that are educated and you give them the right information is very important for me to make sure they know why I'm doing what I'm doing. And I think that patient will come back every year simply because I explain things to them. And I'm not there all day, but I will make sure they get that information. So, yeah.
Wow. Seeing that many patients a day is incredible. First of all, thank you so much there. Having that specialty there is amazing there as well. So it's good to know you do regular eye exams, you do contacts there, prescription for glasses. That's good there because it's needed as well. But when that patient come in and they say, hey, I'm in pain, I'm going through this pain. And I can't figure out what it is. And like you said, sometimes other docs may blow it off and they can't get to anyone and they land in your office and boom, you are the person to not only take care of that problem, but you find out other things exist. Finding that swelling in the back of the patient's eye, sending them to the neurologist, saving their life. Man, that's huge.
That happened today. That wasn't yesterday. That was this afternoon.
That's huge.
Young lady she was very, very happy. They've done 2 spinal taps on her, and they're trying to get everything under control. But she had a problem in her spine, and so we're very That was one. That's one for the books.
and that's great because when you do that, this person like, hey, I'm recommending my mom, my dad, my children are coming to you, my cousins, because you didn't neglect quality of care. Even though you're seeing so many patients, you didn't neglect quality of care. You were able to detect, diagnose, and send her out for further treatment. And that's how it works, folks. Most of the time, optometry, we're the gatekeepers of the healthcare system.
That's correct.
Many times you'll find out things through your optometrist before you find out through your primary care provider.
Correct. Absolutely.
Yeah.
Absolutely. And yeah, her
Wow.
mom said I have their entire family now because her mom was with her today. And she said we transferred all our family to you. I was like, okay.
That's
You know,
incredible.
I didn't do
That's
it for that
incredible.
reason, but thanks. We'd love to see all of you. So yeah,
That's
her mom was
incredible.
very
Do you find many times that optometry and ministry and preaching, do you find a blend sometimes where your optometry becomes a ministry as well? Because people come into the clinic talking to us and you end up on a different pathway in a discussion. And it's like a ministry. Even in my Avon business that I do as
yeah.
well, it becomes a ministry. People out there just need someone sometimes to either listen or to talk a little bit back to them.
Mhm.
Do you find that sometimes?
Absolutely. So my motto is clear in the darkness so that they can see the light. That has a twofold
Yeah.
meaning.
Wow.
Yeah.
Wow.
God gave me that one. Yeah, yeah.
I'm
So
coming to your church. I'm coming to your church one Sunday. I'm coming
I
to
see
your
all right.
church
Come
one
on,
Sunday.
come on. So no, that's my motto, clear in the darkness so that they can see the light. And it has a twofold meaning. Not only am I supposed to help you see physically, but I'm supposed to help you see spiritually. So
Wow.
there's a lot of darkness out there that we have. We have physical blindness, but then there's also a spiritual blindness, and people are yearning for that clarity, for that for that clear vision. And I always say, use your sight. Use your vision, not your sight. Because sight sees what's in front of you, vision sees it visualize what it can be. So when you look at a child, don't use your sight. They may look like they're beat up and from a poor situation. Use your
Wow.
vision and see what they can become. And
Wow.
so I have a couple of mottos that I use, and then they're
That's
just
deep.
part of where I am. But clear in the darkness so that they can see the light is what I live by every day. So I absolutely have ministry overlap, and I prayed with patients. And it's even not even about my particular faith too. Sometimes
Right.
it's just about an encouraging word to someone of another faith. And so
Yeah.
I think that you can be good to everyone. And so I think that in my field of optometry allows me to interact with many people from many walks, from all ages, from everywhere. And it overlaps, Dr. Brown. So it's
That's
amazing to see that. But over the years of practicing, you absolutely have to help folks see in more than one way. So
that's good, and it's good. Like you said, encourage and share the word to inspire someone to lift
mhm.
them. Because many times I find people are in dark places, as you've mentioned already, and
Yes.
they just need to see the light. And you're that person who will help guide them to the light. And that's why I carry myself on social media as Mr. Positivity.
I
It's
love it.
not that
I love that.
every day is not always positive, but I want to share positivity as much as I can, to help shine that light into the area where it may be dark for someone. So I'm
You can
thankful
borrow it,
that.
but you can't keep it.
Say
I said you
say
can
that one
borrow
more
my
time.
motto. I said you can borrow my motto, but you can't keep it.
Can't keep it. Okay, I won't keep it. I won't keep it. I make sure I give the quotations there
That's right.
for
Yeah. But we're all, as a doctor, you're clearing the darkness so that they can see the light. And as Mr. Positivity, I'm sure you do the same thing. I know it.
it.
I have. Mhm.
I
Yeah.
love that. I love that. Now, and as we switch back to dry eye
Mhm.
topic there, guys, forgive me because with this speaker, I told you, I've never had this type of speaker on a webinar before, So we're going to switch to different topics there because he's a gifted man and it'll just naturally happen there. But we're going to come back to dry eye. And if you guys
Yes.
have questions, I'll check that in a moment there. But why dry eye? Of all the different specialties that we can do in optometry, your passion, your desire was to go into dry eye. You have a dry eye clinic. You help so many people. They travel, they fly in to see you. Tell us a little bit what drew you to that pathway.
Well, in the field of optometry, of course, we're all looking for our niche or our area that we really enjoy. And I found dry eye to be one of those where I could really help people that were being overlooked. And I think that also deals with my ministry because so many patients have been to several doctors and no one took the time to listen, to take the time to treat their dry eye disease, because we know now that dry eye disease is chronic, it's progressive, and it can get worse and worse. And so I think the reason I was drawn to it, number one, it fit me. It fit what my aspirations and goals were, and because of that, it naturally drew me into doing it. And the more I learned, the more I want to do it. The more I learned about it, the more I want to do it. And so the practice that I was in, we had an area now that they said, "Hey, you want to do this?" I said, "Absolutely. I want that to be my baby." And so when I took it, I've grown it from it. It has grown over the past 6 years into a mammoth baby right now. It is almost a full grown adult. But it is truly one of the things. What drew me to it was simply that I could help individuals that they had looked several places and still found no help. They had gone to several doctors, and doctors kept giving them artificial tears with no relief. And with my severe patients, they are so happy that someone takes the time to try to treat and manage their dry eye disease. So what is the reason I was drawn to it simply was because I could help those that were not getting what they needed. And I think that's what drew me to it. So yeah. And now it's taken off. It's amazing. So
Those are all great reasons for doing that there, and working in your gift, working with passion,
mhm.
probably doesn't always make it seem like work, as you're helping so many people with this condition there. Having that as your underlying reason there because others people could not find someone who was doing it, someone who would take time to slow down, to diagnose, manage, and treat eye diseases like dry eye. That's great. Thank you again for doing that. Many times we find ourselves doing that. Me, myself, personally, finding myself uh, doing Avon in the memory of my father and service in
Mhm.
the community because so many people say we can't find anyone who's doing it,
Yeah.
and here I am there to help them along with all the other things that I'm doing in life there. So
Wonderful. It's excellent.
that's
That's excellent. When you have a passion behind it, it makes it so much easier to do.
yes, sir, absolutely. And speaking of dry eye,
Okay.
how often do you see this? Is it something that walks into the clinic every day? We're talking about the prevalent of dry eye.
So
Talk a little bit
so
about that for us.
so we have in our population right now, of course, there's 30 million individuals dealing with dry eye disease. Only 16.4% of those 16.4 million of the 30, a little bit over half have even been identified, and only about 4 million of those are being treated. So it is number one underrepresented. It is very, very, very prevalent. And of course, I'm not going to talk about anyone, but I'm going to talk about everyone. Postmenopausal women who, of course, because of hormonal changes, things do tend to dry out a little bit more. And so because of that, we are seeing a market increase simply because it just identified it. Now it's been going on for, of course, ages, but they didn't think it was dry eye. But now we have identified that, of course, those that are going through post menopause are dealing with it. Also, it's more prevalent in women than in men. That's why I said grandma, auntie, because typically women are going to deal with dry a lot more than men, almost double the amount. And also, we're noticing now, though, as well, because our kids are on iPads, cell phones, all these devices, digital devices, they're increasing dry eye at an exponential rate. And we are all guilty of this thing, the cell phone. And so because of that, we're noticing that dry eye is really growing at an alarming rate. And because of that, my services are needed more and more and more and more. And they're projecting that in the near future that it will be one of our prevalent problems. But it is in every doctor's practice, it is in every family, it is in every race, it is in every corner of the world. It's not something that we just have here in America. It's everywhere. So when we think about dry eye and dry disease, the prevalence is outrageous. It is out there. It's just been overlooked. That's been the issue. We've kind of put it in the corner, but now it's getting put to the forefront now. Mm-hmm.
Yes. I think many times dry eye disease is overlooked, underdiagnosed because it's not a simple beast.
No.
It's complex. There's a lot of things involved. And as you mentioned earlier, you have to get to that underlying cause, determining if there's some inflammation
Yeah.
going on, and you can't just throw drops at it, all the time there, you can't
Artificial
just
tears
pump
alone
the
do not.
plugs there. Yeah,
Yeah,
right,
artificial
right.
tears by themselves and in and of themselves are no longer a treatment plan for dry eye disease. And the chronicity of it, or the fact that it's very chronic in nature, people don't realize that it gets worse if it goes untreated. And that's the thing that really is making it more. And we're living longer. I mean, which is,
Yes, sir.
our longevity of life is great. We want to live long. I want to live a long time. I don't know
Yes,
about you, but I,
yes, absolutely.
but because of that, we are seeing that as we mature, of course, things don't work as good as they used to. And because of that, our eyes, the glands along our eyelid, the meibomian glands, are a part of our dry eye symptoms and problems because they stop working as well. And so, yeah,
Right,
the
right,
prevalence is going up. Yeah, if grandma's
yes,
dealing with problems and she doesn't know how to explain it, because many folks don't know how to explain it, it could be dry.
right, right.
Yeah.
And as you mentioned, because we see a lot of children at the office there, specializing in pediatric care, that digital world is really bringing them in, holding things close, and they are getting tagged now into the dry eye world as well there because they're spending so much time on the
On the
devices there and gaming so much.
Yes, and because of that, we're seeing that dry eye is affecting folks younger and younger. So before, of course, most of the dry medicines and the real treatments, the quote unquote real treatments, are designed for folks above 18, but they're now noticing that they're trying to design some things that may be able to help that teenager or
Yeah,
that kid that is just suffering. And so we
right.
want to make sure that and I tell parents all the time, send them outside, get them off those devices, get them playing, get them doing something
Yeah,
else because it really is becoming prevalent in not only older females, it's becoming very prevalent in all races as well as all ages.
right. So when you think about that perfect gift for birthdays and Christmas time, try to think of something that they could do outdoors versus indoors on a device there, okay? You just
Absolutely.
heard from our dynamic speaker there, children are starting to fall into this category of dry eye because of their increased time on digital devices there. So help us prevent this from occurring more, because we're starting to see cases where they're involved.
And people don't realize that when we're on the devices, when we're on our computer or our cell phone or our iPad, we become what's called an incomplete blinker, which means our eye never goes all the way down. It comes halfway and it never blinks all the way, and that causes the corneal surface to dry. So we'll see a band across the eye where there's incomplete blinking. And kids are getting that now where their eye, because they're so busy, they're studying, they're looking at it, so their eyes do this. They like, there it goes. It blinks like this versus
Yeah,
closing and opening. Because your eyelid is designed to take the tear and drag it across the eye. So when you have it doing that, that's when there's a problem. Okay. Oh, my
yeah.
phone.
Look, yeah,
Wait. Decline. I'm sorry,
that's
everyone.
okay.
I'm
That's
sorry.
okay.
Okay. My
That's
phone
okay.
tried to answer the phone call. Okay.
What Dr. Summerow was talking
I'm
about
back. I'm coming
is
back.
true.
There
You're back. You're there.
you
Can't get rid of you right yet.
go. So,
But there was a child in the
right.
office
No,
today.
no, no. Yeah.
There was a child in the office today under the age of 3, and most of the time in the office they had a device in front of them using it, while their parent was going through the exam. It keeps the child quiet, So it has purposes for doing that, but we should just
Right,
control how long they're on those devices as well there. So
right,
that's all.
right. Exactly, exactly.
Now,
So that's yeah. Go ahead. I'm sorry.
no,
Mhm.
I was going to say you talked about how dry eyes may be overlooked, underdiagnosed, but let's talk about it being misdiagnosed. How about that? Is that occurred?
Every day, every day, it's misdiagnosed as allergies. A lot of people think that their eyes are going through allergic symptoms when it's dry every day. Some people think that they have a pink eye. It's dry every day. This is what
Yeah,
I deal with every day. I mean, patients, oh yeah, I've been to the doctor and they've been treating this, and it keeps coming back and it won't go away. Well, all along it wasn't pink eye, it wasn't allergy eye, it was dry eye. And they were trying to treat it as if it were a pink eye or an allergy eye, and that's why it keeps roaring back because they never treated the actual dry eye or the problem at hand. So I see that every day. Is it misdiagnosed? Every day. And I
wow,
love my doctors and I understand because we are trained to look for the of course the big thing. We're trained to
right,
look for the thing that we're accustomed to seeing a lot of, and that's what typically is a red eye, maybe an infection, a bacterial, viral, or any type of bacterial infection or something like that, which causes a red eye, which causes a problem. But we're finding out now that a lot of these things can be caused by dry eye disease, especially if it's chronic, especially if they've been dealing with it for years and years and years. Patients that say my eyes are never white, my eyes are always red, my eyes are all. And one of the simplest things that I've noticed that will help dry eye patients is turning off the ceiling fan above their bed while they sleep.
wow, wow.
All the
Yes,
folks out there right now, your ceiling fan is drying out your eye while you sleep.
wow.
And
Isn't
I,
that
I
something?
will do that. Whenever I lecture, I will go talk to doctors and I'll say, how many of you have a ceiling fan in your bedroom? Show of hands. 80% of the room. And we don't associate that with dry eye. We don't
Yep.
we don't think that that could be part of the reason we wake up in the morning, our eyes are red.
Or they're working all day under a vent. An AC vent is right there on top of them at work as well, right?
Yes, sir.
Or they got that fan, if they're still using that fan that's on the floor that's turning.
Dr. Brown, you becoming a dry eye specialist. You're doing it right.
Yes,
You're doing
yes,
it right.
another one.
So once again, those are simple things, and I'll ask that question. I'll say to them simply this, hey, you are dealing with dry eye right now. Do you have silver band on? Oh yeah, I do. But I get my hot flashes. Boom.
Mm, that's
So,
it.
and I'm not gonna tell a postmenopausal woman with hot flashes to turn off her ceiling fan. I'm
Right.
gonna I'm gonna treat her dry. I'm gonna treat her
Right.
dry. So that's exactly
Exactly.
what I'll do. I tell them I'll never tell you to turn off your fan, but I will help you treat it. So
Yeah,
that's yeah.
absolutely. And,
Oh,
and, and
there's a
speaking
question.
and speaking of treating, Mary Payne, thank you for putting that question down there for us. You're jumping right into one of our segments there. Mary Payne want to know, Doc, how do you treat dry eyes? How
Oh,
do you treat dry eyes?
well, there's a lot of things that you can't do. There are three major medications that are out there right now to treat dry, meaning they're FDA approved to treat dry disease: Cequa, Restasis, and Xiidra. I have lectured, and I have a national lecture for two of those companies. I lecture on those drugs right now. So two of them, I'm with AbbVie and with Sun Pharma. So I actually lecture. I have to do that disclosure, so you know.
Yes.
But with those things, but treatment involves more than just giving you one drop. There's warm compresses. There's not only that. There's spray to help the lids and the glands open up and properly produce your meibum along your lids. So dry eye treatment is not a one thing, one drop, you're done type of treatment. It's a multiple. I give my patients a sheet when they leave the office, instruction sheet, and they may have four things to do. They'll have an artificial tear, they'll have their medicine, they'll have the warm compresses, and they'll have their spray. They may have a pill to take. I actually treat it. We actually treat patients now with some pills called Hydro Eyes or others that are oils that will go into those glands and help those glands produce the oil properly in the tear. There are treatments I do from, like I said, there's a treatment called IPL, which is intense pulse light, as well as there is the treatment we do called LipiFlow, tear care. The list goes on and on. That's why you can't just go to the drugstore and pick up your favorite tear and say, I'm cured. It's not.
Right. Right.
It's typically multifactorial, and we need to see exactly, because I tell patients there's evaporative dry eye, there's functional dry eye, there's types of dry eye. And if you treat the wrong, it's just like treating diabetes when you should be treating hypertension. They're not the same. You have to treat what is different. And so functional dry eye is one type, evaporative dry eye is another type. We do what's called punctal plugs. I do a lot. I do something called BlephX, where I clean the glands and let them open up. I do, there's something called amniotic lenses, of course, that I do as well. Now we just have a new drop that's from the placental tissues, and it's called Regenerize. There's also a new that I just got from another company where we have to mix it in a chair. We put it on the eye, and it helps regenerate the corneal surface. So yeah, I'm deep in dry.
There are options out there. You are the specialty expert for dry eye, and that's why you should know, more than just one way. And as you say, there is not just a one drop that's going to do it all. There's not a magic drop out there. And those who are listening, I want you to be careful what you pick up in the store, because some of those drops can have things in them that can do more harm than good. Especially if you're on them long term for trying to take the redness out. You were doing it for the wedding, but you ended up using it over and over and over again. So
Brown, you're stepping on toes, my friend. So the truth of the matter is absolutely that. People that use eye drops to get the redness out chronically or daily can actually cause more redness than less, called medicamentosa. Of course, we know that as doctors, you use that tetrahydrozoline and others in your eye consistently, your eye becomes used to it, and then when you begin to take it off, your eyes are actually more red than less red. So yes, absolutely. If they're using the wrong drops or incorrectly using the drops, that can be a major issue. Yes, sir. Okay.
Great.
We got another question.
Yeah, so we got Mr. Rudolph Card. Rudolph Card is saying, what are symptoms of dry eye? We've talked about some of these early on there. If we just want to do a quick review of that.
Absolutely. Tearing eyes that won't stop running. You're dabbing your eyes throughout the day. Grittiness, sandy feeling, redness, discharge, all those things that they can be symptoms of dry eye. Discomfort, blurred vision, all of those things can be symptoms of dry eye. So it can be a combination. It can be one or two. We do testing to test your tear function called Inflammadry, which we test, and also tear lab. So we check your tear function and the inflammation in your tears when you come for your evaluation in my office. So but the symptoms can be all of those things, Mr. Card. Thank you for that question. Excellent
Thank
question.
you. Absolutely. Dr. Summerow, if someone was coming to see you for a regular eye exam, do they need to be rescheduled for a dry eye appointment because it's so complex and so much is involved in it? Sometimes people feel they come to the office and they're going to get everything taken care of in one visit. And that doesn't always work. When I used to work with a glaucoma specialist, we had to bring them back for the visual fields and the OCT, all of those extra tests that we're doing. But, maybe you all can do it all in one day. How does that work?
Yeah. you touch on it perfectly. So we will do your routine comprehensive exam where we do your glasses, your contacts, your routine care. And if we detect signs of dry eye, we will schedule you for a dry eye evaluation. Those are two separate exams. Those are two exams where we do different things, and they are designed to do what they're designed. And your insurance will cover it. In most cases, a dry eye evaluation is also covered by your medical insurance. So I tell
Wow.
people that they think that there's an addition. Now, if you have a vision plan, VSP, IMED, that's not what I'm talking about. Dry eye disease, a medical diagnosis that's billable to your insurance, and your insurance company can and will pay for your treatment. The drops like Xydra, Restasis, and Sequa are expensive, and so now the most insurance companies are requiring that you have dry eye proof before they will pay for those drops. So before you get any of those drops that are expensive, they're going to say, how do you know you have dry eye? So if a doctor just writes it and it gets denied, or they get a prior authorization and they can't check yes to some of the questions, the drops are denied. So yeah,
Oh,
we have
wow.
to do a separate exam, and that's what we do. Yeah.
But
Because
the good news is it's
it's
covered mostly through your
right,
medical
medical insurance.
insurance.
That's correct.
Yes, that's a
That's
good thing there. Many times we have to break that down as well. Routine eye exam versus a medical exam. Coming back as an office visit. It's a different specialty. It requires more work from the doctor and the doctor's education and wisdom. So that's why those things have to be separated there for those purposes. Now,
And the
um,
insurance company won't let you piggyback your services either. They
no,
won't let you put all that stuff on one day. They're going to be like, we're not paying for that. So
no.
you have to bring it back for a separate exam.
Yes,
Yeah.
yes. As we are trying to wrap this up, because I know you're a busy man, you had a long day.
Wow. If the hour
Those who are listening may wonder, what can I do to prevent dry eye? Are there things that we could do at home? Or are there things that, maybe we can avoid in order to not go through this pathway, or not get to such a great point for dry eye?
Definitely some of the things I recommend all my patients: a good healthy diet, a good healthy diet, a good healthy diet with fatty with the omega-3, 6, and 9s in your diet are clearly been shown to help improve dry eye. And some of the pills that we give patients when we are helping them with dry eye is that we'll give them those things and supplement their diet. Sometimes, as far as helping your eyes not have it, uh, I would say definitely getting proper rest, the things that we don't do, taking
Yes.
care of yourself, those normal everyday things that we would do. Some of the foods now have been tied to some dry eye disease issues, as well as the number of medications we take. I have a complete lecture on dry eye disease and medications. I've lectured on that. And there are so many medications that we take. When you're taking 1, 2, or 3 medications, automatically you're going into dry eye. Glaucoma medication is notorious for causing dry disease, but those are things that you have to do. So once again, is there a way to stop it or prevent it? Eat healthy, take good care of yourself, and of course, proper cleaning, proper hygiene of your eyelids, and structures will also help with dry eye disease.
Thank you so much. Yeah, we actually gave a patient today some lid scrubs to
Yes,
use there for that cleansing around the eye area there as well. So you
that's
you hit
huge,
you
huge.
hit yeah, it's important. A lot of people don't think about it. You hop out of bed, you take care of other areas of your body, you forget all about here. But it's important. You don't want things building up
Get
under
in
your
your eye.
eyelashes. You don't want mites under your in your eyelashes
Another
there as
lecture.
well.
That's another
So
lecture right there. You want me to get
yeah,
into that?
that's a whole nother lecture
Oh,
right
another
there.
lecture.
Well, thank you for touching upon that. I'm going to check just to make sure I didn't miss any questions here from our audience today. Definitely want you to let people know how they can follow you, either come see you if you're accepting new patients. They can come see you, to get inspiration from you. Maybe even go to church and listen to you.
No,
Wow.
I'm on pretty much, I think, also. I know you can find me on Facebook and Instagram. On Facebook is my page is Dr. Stephen D. Summerow, and you can find me there, and also Pastor Stephen D. Summerow. And you can just look for me and find my picture. I should be easy to find as well. Our office is Eyesight Associates in Warner Robins, Georgia. And you can go to our website, which is, of course, eyesightassociates.com, I believe it is. And of course, social media, Instagram, Summerow1, my last name and the number one. And also my name in and of itself, if you want inspiration, Pastor Summerow on Facebook as well. So I've pretty much got my name everywhere. My website is Dr. Summerow, Dr. Stephen Summerow. It will also take you to all of my platforms. So thank you. I appreciate you guys for having me. But if anyone, I am definitely accepting new patients for a routine exam, maybe a month or so, 2 months to see me. But we will get you seen. Yeah. So, but I'm accepting new patients, and I haven't had to turn anyone away at this point. Just maybe a little bit of a wait. So.
Right, right.
All right.
But what's that saying? Good things come to those who wait.
There you go. There you go.
He's worth the wait, folks. Don't delay. Schedule your eye exam today. Go in to see your local optometrist if you would like to see our dynamic speaker for tonight, Dr. Summerow. He is there, ready, willing, and able to serve you there in Georgia. So we appreciate you for being on the call. And if you follow him on YouTube, you may hear him lifting one of those good old Baptist hymns as well.
I have a YouTube called Summerow Insight. And we're building that now. So if you want to go look there, my YouTube is Summerow Insight.
Okay. Excellent, excellent. Yes, I just want to make sure they know that he's there. Yes. He is a talented man, multiple hats he wears, and he wears them well. Thank you for sharing tonight. Thank you for the wisdom that you poured out. Thank you for the inspiration that you've given to our listeners, also to myself. You know, I'm always happy to join with you there, to be in your company. You're a great person. I'm glad that we're colleagues there and that we can depend on each other whenever we need one another to be there to support there. So you have been a great help being on this webinar and sharing with our listeners about dry eye and options. The National Optometric Foundation, along with the National Optometric Association, we appreciate you for being on the webinar there, and hope that in the future, maybe we can have you back on as one of our guest speakers on the show there. So everyone, we want you to give some love, show some love, give some likes, put some comments in the session there for Dr. Stephen Summerow there for his great word tonight. Thank you, Doc. Appreciate you.
Thank you so much for having me. We really had a great time. Thank you.
Yes, sir. And as I get ready to wrap up our webinar, another fantastic webinar here with you who are listening tonight there. I want to thank you all for tuning in. I want you to make sure that you share this. If you know someone who was able to tune in tonight, you can share the link to this webinar on our YouTube page there. We have our website, nationaloptometricfoundation.com. We're also on Facebook under the same name, National Optometric Foundation. We have our YouTube channel that you can go and subscribe to, and you can find this webinar posted there as well as our previous webinars. We're going to continue to do this education for our community, and if you guys will allow for us to continue to be the nonprofit organization supporting those who are thinking about becoming an optometrist, continue to support the National Optometric Association doing free eye exams in the community. We have a Cash App that you can donate to, $ protecting the vision, and you can donate there. Anything is greatly appreciated. We want to thank those who have come alongside with our foundation and the association to allow us to be able to do those things there. So you guys tune in next month. We'll have another great speaker on the third Monday at 7 p.m. Eastern Standard Time. And I look forward to being your host again, Dr. Timothy Brown, Treasurer for the National Optometric Foundation, signing off. Thank you.